Welcome to this screencast, where I will discuss briefly some of the experiences and share some testimonials how interprofessional learning activities take place at my workplace, Stockholm Sjukhem. My name is Annina Kangasniemi, and I work as a registered nurse and clinical adjunct. In our different departments and units, we offer clinical training opportunities for students from vocational, undergraduate and graduate programs, including medical, nursing, nursing assistant, physiotherapist, occupational therapist, dietitian, and logotherapist programs. As for example, here you can see a clinical training model for undergraduate nursing students provided by Stockholm City Council. This learning model has three pedagogical perspectives. It is student-centered, person-centered, and interprofessional. And by interprofessional, we of course mean that when two or more professions learn with, about, and from each other in order to increase collaboration and the quality of care. For this next part of this screencast, I interview three of my colleagues and share some of the highlights of their testimonials, how they experience interprofessional learning in everyday clinical practice. In this first interview, I talked with Helena Levealahti, who is the educational strategist at Stockholm Sjukhem. She has a long career behind her, both in clinical practice and also in educational practice. She sees the benefits of interprofessional learning leading to positive outcomes in collaboration, teamwork, and that opens a broader view to the patient care. Also, she has seen in recent years how the hierarchical structures diminished as a result of interprofessional learning. She has a very realistic point of view when she shares about her challenges, and especially she sees still that there's a gap between the ideal and reality. And how she describes different educational programs is like isolated tubes producing medical, health, and social care professionals, and all of a sudden they should be able to collaborate upon graduation. So her recommendation is to start IPE practices very early on in undergraduate programs. She highlights the importance of attitudes, that we need to be ready to share and also to receive education and learning from each other's and other professions. And she sees reflection as an important part of the teamwork. Next, I talked with Ingrid Benström Lund. As a benefit of interprofessional learning and education, she mentions that the training increases understanding of different professional roles, gives different perspectives and possibilities in patient care. As a challenges, she shared that every now and then a friction and tensions can exist between different professions. And her recommendation is that to respect different professional roles in patient-centered care, that each and every one is needed. She recommends taking time when implementing in practice, and especially in clinical training for students, in the interprofessional clinical training of students. She recommends that we enable the students to meet together, sit together, and talk about the patient together, and if possible, even meet the patient together. And as a final pebble of wisdom, she shared that open communication always leads to better collaboration. And lastly, I spoke with my colleague Franziska Edvinsson. She considers it important to have the ability to relate to different professional roles in a team. And she wanted to highlight the importance of teamwork and how each professional role and team member work together for the best of the patient. She also sees reflection having a central role in teamwork, especially if something has not gone as planned. She sees hierarchical structures as a challenge and hindrance and would like to see them disappear completely. Her recommendation is to start building professional relationships at work as well as outside of work. And lastly, she wanted to highlight the importance of respect. Thank you for listening, and do not hesitate to contact us for further questions or start the discussion on our discussion board.